Welcome everyone, and thank you for joining us for today's webinar, Securing Medical Devices, Streamlined Access Controls by Imprivata. I'm Chris Higgins, Marketing Programs Manager with Imprivata, and I'll be your host for today's session. I'm excited to be joined today by Rachel Pickering, Product Marketing Manager at Imprivata. Welcome, Rachel.
Thanks, Chris. Great to be here.
I'm going to turn it over to Rachel in just a minute, but before I do, I have a few quick housekeeping items for our audience. First, everyone who registered for today's session will receive a recording of the webinar. Second, if you have any trouble with the audio or video today, try logging out and logging back in, which in most cases should resolve the issue. Finally, please feel free to ask any questions via the Q&A panel on the right-hand side of your screen. We'll leave time at the end to get to everyone's questions. All right, that's enough for me. I'll turn it over to Rachel to get us started.
Great, thanks, Chris, and thanks everybody for joining us today. I'm really excited to take some time to talk a little bit more about the unique solution that Imprivata brings to medical device security. And in doing so, what I want to do first is level set a little bit on what's going on with medical device security today. Obviously, it's top of mind for everybody from regulators to healthcare providers to patients as incidents related to medical device security start to crop up in the news. And it's one of those things where it's sort of, we're really just starting to create a path that takes us successfully to where we need to be in terms of security. The reason it's been so difficult for so long is a number of reasons, both to do with legacy software, the speed of design for medical devices, the network infrastructure that these devices live on, and it's really just within the past couple of years that the proliferation of devices communicating over the network, pushing data to the EHR and to other devices has started to skyrocket. And obviously with that new robust technology, the closer it gets to the point of care, the more concerns you start to see. So the things that we're looking at when it comes to medical device security is things like exposure of PHI, which obviously leads to HIPAA violations, and ultimately impact of patient care. And we'll talk a little bit more about how each one of those comes into play, but it's important to understand that people are finally starting to really look at the problem and look at what we need to do to fix it. So we've got regulatory bodies who are starting to chime in, the Department of Health and Human Services, the FDA, NIST, and they're all looking at it a little bit differently. Fundamentally, what the largest amount of regulations have been centered on is making sure that these robust devices and the security that gets put in place with them doesn't impact patient care. And with that, it's important to understand how those layers of security affect clinical efficiency. So if you take a look at what those top areas of concern are, they fall into a couple of different key categories. First and foremost, confidentiality. Obviously, there's been the foundation put in place for HIPAA compliance, for making sure that as patients and their information starts to get stored in multiple places throughout the network, throughout your hospital ecosystem, making sure that that information is kept confidential. It's no longer easy to just lock a door and have some paper records stuck behind it for only one or two people to get access to. Unfortunately, as we get more robust with this interweaving network of information, you open up points of exposure from multiple different places. Additionally, integrity comes into play. So like I mentioned, these devices are now starting to talk to the EHR. They're now starting to pass information over, and that information with smart technologies like early warning systems is able to start to become aggregated and help clinicians in making clinical decisions and identifying the status of a patient and whether they're deteriorating. So if you open up the ability for somebody to get access to one of these devices and alter data or change change the flow in which that data is coming in. It takes away from that information that's being pushed to that EHR, and that's sort of what we expect to be the source of truth. So if you have unauthorized users, unauthorized folks, whether it's through the network or through a child playing around in a patient's room, if you start to degrade the integrity of what information is being pushed to the EHR, being pushed to that source of truth, there's a lot of downstream impact that can come from that. Obviously, when you start to look at devices that are even more closely related to patient care, so things like infusion pumps or respirators, that's where you get into the real scary stuff. Somebody potentially being able to come in and take a device offline or make someone unable to get what they need out of that device. So availability is the next piece where people are really concerned. How do I make sure that the devices that I have in place are constantly available so that the patients who need them have access to them, so that the clinicians who need to use them have access to them? And ultimately, that last piece comes down into patient safety. So organizations, both on the medical device manufacturing side and the IT infrastructure side, and the provider side, the healthcare organizations are trying to look at, how do I handle this properly? How do I start to remove some of these areas of concern without frustrating my clinicians and without getting in the way of patient care? So, like I mentioned, the organizations, the regulatory bodies are really just starting to sort of put their thumb on what the problem is and where we need to focus. As of right now, and as of up until just a couple of weeks ago, the current state of regulatory was just kind of NIST best practices, right? It's fundamental security, do your best to make sure that you're closing as many loopholes as you can, but that there was pretty minimal regulations for health systems. So understanding, well, where do I focus and what do I do is pretty difficult when you look at the entire security framework, and you've got these devices that traditionally weren't built with security necessarily in mind, because when they were designed, it was, 10, 15 years ago, and the amount of change that's happened within the cybersecurity ecosystem is tremendous. So it's important to understand where to focus and what your best bet is. And one of the things that we're starting to see is that, unfortunately, with medical devices, one of the most fundamental security practices that's out there is not always taken into account, which is strong authentication, right? You put a password on your endpoint, you put a password on your phone, you put a password pretty much everywhere you go. And what we're seeing is it's sort of just starting to get to that point to medical devices, requiring that strong authentication to make sure that you can be incredibly sure that the user accessing that device is that right user. To go one step further, just last May, the Department of Health and Human Services came out and really extended their definition of a workstation as it relates to electronic patient health information and HIPAA compliance. So previously, their definition was workstation, and fundamentally, people associated that with laptops and desktops. And so if you look at the endpoints in your environment, those are secured. It's likely that those are secured with the best possible measures that you can get. It's pretty standard. But now the Department of Health and Human Services is coming out and saying, well, you guys, just so you know, it's not just a computer that interacts with patient health information. It's not just a laptop or a desktop that's going to open you up to risk. Any computing device that can interact with electronic patient health information can be a point of exposure and needs to be locked down. And if you don't lock that down with some sort of physical security, you're putting your organization at risk for HIPAA compliance. And so they go through a number of solutions that you can employ, and some of them are kind of archaic in terms of locking a device behind a door or putting screens up so that people can't catch things from the angle, but it's still sort of missing that fundamental security practice of username and password, right? Strong authentication to make it so that you can lock down a device and keep it out of the hands, keep that patient health information out of the hands of the wrong people. And so one of the reasons why folks are sort of skirting around this strong authentication, this enabling of username and password, which, as I mentioned, is fundamental to security in almost every other part of the IT ecosystem. The reason it's not being as adopted for medical devices is because it's hard, right? You talk about how difficult it is for a clinician to log in and out of a desktop on their computer, on their keyboard over and over again. It's frustrating. You have password fatigue, and they have to do it so many times for so many applications. Now, when you take that aside and you take a look at a medical device where you're trying to type on this sort of soft touch giant piece of hardware on top of a long skinny pole, that efficiency, that issue is compounded. So you've got nurses, you've got PAs, you've got clinicians who are moving from room to room, logging in and out, time after time, trying to capture vitals or do what they need to do with the patient. And what's happening is that username and password, if it's not built with efficiency in mind, it can really get in the way of patient care. And then you open yourself up to a litany of password workarounds and insecure security practices because you haven't enabled something that's streamlined and done with clinical workflows in mind. Obviously, the alternative is not to require authentication for medical devices, and as we see from the Department of Health and Human Services and really just security best practices with NIST and everything else, if you don't require that authentication, not only are you opening yourself up to security risks as well as auditing challenges, but now you're facing HIPAA compliance potential fines there as well. So here's sort of what a workflow looks like today when you don't have a streamlined way to authenticate a user. You've got a nurse or a clinician who comes in and maybe they grab a patient monitor, maybe it's a spot check monitor, and they're starting to go out on their rounds, and they've got 10 patients, maybe sometimes 15, and they have to go around a couple times a day and go and take the vitals of patient A and then patient B, and they have to log in and out every single time they take vitals and push it over to the EHR. So, you know, that username, that password, the complex characters, they're doing that over and over again, and if they start to run into frustration, if they start to have trouble doing that, they're not going to go and continue taking time away from the patient, continue spending minutes at a time trying to figure this out. What they're going to do is they're going to step away from that robust device that you've invested money in, you've invested infrastructure in to be able to communicate real time with the EHR, and they're going to start manually recording. They're going to go back to the old days of writing things on their legs or on their gloves, and they're going to stock it up because they've got to see 10 patients in an hour and get all that information and move on. So you've got a backlog of this information. So you have batch entry, and you have them waiting till the very end of the day to enter all of this information in. And one, you're taking away that real-time visibility that you've invested in with these robust machines. A clinician who wants to go and check in how's patient X, Y, and Z doing, if that information isn't there right away, they're not able to help make some of those clinic decisions to figure out what's going on with the patient. And then you're opening it up to accuracy and human error, right? If you've got a whole day's worth of information and you've got patient A on one leg and patient B on the other leg and patient C on the back of your notepad or whatever it may be, you're opening up your organization to an incredible amount of accuracy and human error issues. So again, you're starting to affect not only the confidentiality of writing down information somewhere, you're affecting patient safety, hoping that the clinician can remember and make sure that they can read every little bit that they wrote down and tie it to the right patient. And then, you know, you're starting to degrade the integrity of that data as you're pushing it in there. So that's where Imprivata has come in with our solution, Imprivata Medical Device Access. And what we've done is we've created a unique offering specifically tailored to the workflows of medical devices and how those devices are starting to communicate with each other over the network to the EHR and to other systems. And we've been able to bring our workflow and security enhancements that we use in other areas of the hospital to these medical devices. So between a combination of access control and workflow visibility, we're able to help you paint a better picture of who is interacting with which devices at what time, so you can get a handle on if something's going wrong, so you can get a handle on who's doing what. Natively, a lot of these devices, you might see that someone did something at some time, but you didn't have a good handle on who it was. Who was the specific person who checked that vitals? If you're using a shared PIN or a department-wide password just to get in there and streamline and get away from having to use these complex passwords that your nurses are going to avoid, you're not going to be able to know and look back and see who did what. So by implementing Imprivata medical device access, what you can do is you can start to improve those workflows, right? You can improve security of the patient health information that you've got on these robust devices by making secure authentication practical. You're avoiding those security workarounds. You're avoiding somebody sharing passwords or writing it under the board. You're avoiding, having someone leave something unlocked. And you're doing so by ensuring efficiency by replacing usernames and passwords with fast automated authentication. Primarily what we're seeing is people using proximity cards. So you've got your clinician who's already using their proximity card to get in and out of the hospital. They're using it for their endpoints and for their single sign-on. So they've already had this sort of native habit and understanding of tap in and tap out, and now what we can do is bring that workflow to these medical devices to streamline access there. And on top of it, increase visibility. You've got these devices in-house. Oftentimes, if you want to pull an audit log of what was going on, you have to take the device off the floor, pop in a USB, download the data, put it into a different endpoint so you can start to analyze it, and it's really cumbersome. By enabling the Imprivata authentication, what you can do is move that visibility to the server level and pull it in with the same reporting that you're already using for your single sign-on or for your EPCS solutions. So you're really cutting down the number of places that you need to go to get this understanding of what's going on in your environment. And then the final piece, like I said, is improving patient safety. So whether you're talking about making sure that the data that's getting piped into the EHR is accurate, or making sure that for certain devices you can't go up and make settings changes, right? If you're talking about something like an infusion pump, the ability to lock down that pump and keep somebody from playing around with the titrations or accidentally hitting a button that could actually cause real patient harm is really critical as you start to get more and more robust technology. So by doing so, what you're able to do is really streamline this entire workflow. So a little while ago, I walked you guys through what that workflow looks like without streamlined authentication, and now we can take a look at what it looks like with it. You go from something that can take 25 to 30 seconds to log in if you do it right the first time around, which I don't know if any of you guys have ever gotten your hands on some of these devices. It's not easy, to this really simple streamlined authentication with a badge tab. So you take in something that went from about 20 to 25 seconds down to 2 seconds to log in. Once you do that, you're able to get this information very easily. You got the patient information, you have the user information, now you have that health information, and you're able to immediately, in real time, send that over to the EHR. So you're taking a convoluted workflow and you're turning it into something that's streamlined that people are going to comply with because you do it so easily. And what that does is it opens you up to that real-time visibility so you don't have to wait till the end of the day for a doctor to come in and see information on a patient. They can get it the minute it was taken, which is why you've invested in these robust technology anyway. And you can ensure that the data getting pushed there is solid data because you've been able to control and make sure that only authorized users are able to push that send button and push that over. So it really helps establish trust between the device and the users who should be accessing it, as well as between you and the information that you have getting pumped into your system. So what we see from our customers is a number of quick wins with this streamlined authentication. First and foremost, for the clinical side, is a reduced time to log in. Like I said, we're able to take that manual login that's often 20 to 25 seconds down to a 2-second badge tap. That number gets even higher when you think about the number of fat fingerings and difficulty logging in. So you can really take away some of that password fatigue, some of that technology fatigue, and give your clinicians more time to focus on the patient care without frustration. The other thing we often see is for certain types of devices, organizations are still using these department or team shared pins or even factory set pins, 0000, to avoid having to have your clinicians remember an extra password. You're using these shared pins, which A, doesn't give you any sort of visibility into the user information, who is taking what actions on these devices, but B, oftentimes these pins are put right out there on the internet in factory settings and in documentation, and it's pretty easy for somebody to look it up and be able to get into a patient monitor or get into something else that holds patient health information and grab that information, and then all of a sudden you're looking at a HIPAA fine. So enabling your clinicians to, or enabling your IT team to implement stronger security controls without getting in the way of clinicians. On that same note, right, we've got customers who normally for, say, take a patient monitor, a vital sign monitor, for example. Normally what they would do is they'd set a grace period because the username and password is so cumbersome, and they'd say, all right, you only have to log in once in a 4-hour period. Now, we all know if you're a clinician, you're a nurse, and you grab a device and you go and take 4 patients, and then maybe you get pulled somewhere else because of an emergency, and that device goes and it sits out in the hallway, and if it's unlocked, boom, you're looking at HIPAA compliance fines. The other option is that somebody else grabs that device, and now they start to take their vitals, and all of a sudden you're accidentally charting under somebody else because you've left that device open. It's insecure, it's PHI exposure, it's data integrity. And our customers are able to take that auto lock parameter and dramatically reduce it. We have customers who are locking out these devices now after about 4 minutes. Because it is so easy to just turn back around and tap your badge and get back in, it's not causing frustration, so it's allowing you to have tighter security controls, again, without getting in the way of that patient care, without frustrating your users. So it's not a big deal if your nurse comes in and starts to take vitals and gets distracted or checks on something, has to go back and finish the vitals. They tap their badge again, and boom, they're right in there. The information is saved. You don't have to worry about somebody else getting access to it, but it's not also going to be a barrier for them to get back in and start over. And then again, we mentioned that complete visibility into user interactions with these devices. So often what we hear is, I have audit trails, I know that people are logging in and out, I know that information is getting pushed to the patient record, but I don't know who's doing it because we're using that shared password or because we're leaving them unlocked. So having that complete visibility into user actions with these devices is huge. And then finally, you're going to improve compliance with your security protocols. Because you're doing so, you're putting these security tools in place in a way that isn't going to lead to inefficiency. Therefore, your clinicians are more likely to remember to log in and log out and to use these channels that you've put forth so that you can ensure that your organization, that these devices that are connected to other pieces of the network and other medical devices are locked down and are secure, so you can feel a little bit better about your network overall. So Improvada's solution specifically, today we integrate with a number of different medical device manufacturers on the patient monitoring side. And it's a pretty simple API level integration that allows for user authentication. You're tapping your badge to be able to get in there, get access, and send information over to the EHR. We've got our comprehensive auditing that's similar to what you might see if you're a one-sign customer or maybe a Confirm ID customer, and that auditing is going to fall into that same central management console that you already are using, so it's a simple place for you to continue to add information to help you as you're going throughout your day. And if you've got one of these devices in your ecosystem already, we are backwards compatible. So right now, as I mentioned, we're working with Philips, WellChal, and Capsule on a number of their different devices to help streamline this authentication as these devices pull vitals in and then push them over to the EHR. So with that, I'll turn it back over to Chris for any questions.
Thank you, Rachel, for a great session today. You covered a lot of really useful information for our audience. So as Rachel said, it's now time to get to your questions. As a reminder, please enter your questions into the Q&A box on the right-hand side of your screen, and please be sure to use the question box and not the chat box. We'll just give folks a minute or so to type in their questions. Okay, Rachel, we have our first question. This audience member asks, what happens if a clinician forgets their badge? How do they log into the devices then?
Sure, that's a great question. One of the things that it's important to understand is obviously that it's critical to not ever really impede somebody from being able to use one of these devices. So depending on the type of device, there's a number of break glass considerations. Obviously, even though you're using your badge, you always can go in and manually enter a username and password. So if for some reason they don't have their badge, they can do that. We also don't necessarily lock out the whole device. We simply lock out the data that's stored on the device and the ability to push that data over to the EHR. So if you take a look at some of the devices, you can get in and take vitals, and you might be able to sit down and still use this device to get the temperature and the blood pressure and all of that. But if for some reason you really can't log in, you would have to go back to that manual entry into the EHR, but you're still going to be able to take the vitals and capture them. You just won't be able to push them directly to the EHR from the device.
Great, thanks, Rachel. We have another question that came in from the audience. It asks, would this use existing proximity cards to authenticate the user, or would we need new proximity cards?
So that depends on the specific devices that you have in-house. Generally speaking, I would say yes, the proximity cards would be compatible with these devices. Again, it depends slightly on the device manufacturer. Some of them have different frequency readers built in. If you look at our Capsule in our WellChal and in our Philips devices, some of them have the reader integrated directly into that barcode scanner that you're using to scan the patient's wristband. And so the frequency that's built into their reader, it's a dual prox card barcode reader, will most likely be compatible with most cards out there. We do have some workarounds if for some reason your card isn't compatible, but that would be something that we would have to check on the device manufacturer side.
Great, thanks, Rachel. We have another question, and this person asks, do I have to take the devices offline to install and update if Imprivata releases something new?
No, so that is a great question as well. I know that one of the difficult pieces with medical device security in general is that patching and updating software can be difficult because you often have to take these devices offline. Because of that, Imprivata's designed our integration to speak to these devices at a server level. So often you have a device that connects to some sort of a connectivity engine or their own inherent server, which then pushes information to the EHR, and it's at that server level that we integrate. So if you see this diagram up in the top right corner, basically what happens is our authentication is enabled by some sort of a reader on the device, but Imprivata is actually speaking to that server. And so once the information gets to the server, they kick it out to Imprivata and say, hey, can you verify this identity? Once we've been able to authenticate that, we go back to the server and say, yes, this is an authorized user, and the server is then able to push information over. So because of that, we don't actually have anything directly on the device. So if we were to rev our software releasing some sort of an update, it wouldn't need to have any sort of changes on the device.
Great, thanks, Rachel. Let's see, we have another question in. This one asks, how difficult is this to implement if I already have my devices rolled out?
So it's a pretty easy implementation as long as, obviously, it's one of the devices we support. So if you take a look with Child and Encapsule, there are specific devices that we support. Occasionally, you may need to make sure that you're on the right version of their software, but standardly with these devices, most devices tend to be on the latest version. It's not like some of the larger things that take a lot of work and time to update a version. So as long as it's on the right version, it's a pretty simple implementation. From an Imprivata side, the policy setups are relatively easy. And then from a device configuration side, there is some configuration on the device side as well. But standardly, it's a pretty light lift.
Great, thanks, Rachel.
Mm-hmm.
I think in the interest of everyone's time, that'll pretty much wrap it up for our Q&A session today. If by any chance we didn't get to your question, we'll make sure to follow up with you offline. Just wanted to remind everyone that anyone that registered will receive a replay of the webinar. And so at this point, I want to thank everyone again for joining us for today's presentation. This concludes our webinar. Take care.
Thanks, Chris. Thank you, everybody.